you very much, all four of you, for coming to speak to us today. Just following up on a couple of things that was said in response to Luke's questions. So you've talked about suspending or postponing non-elective procedures in the NHS, and you also talked about cancer kind of procedures as well. I just want, forgive me if this has been mentioned all the way, I just want clarity. How are trusts still going to be measured against existing targets, such as the 4-hour waiting time in A&E, or are those going to be relaxed for the duration of this pandemic?
So there are no changes going to be made to the measurement set, but the reality is that we are asking the whole of the NHS to mobilise around doing the right thing under this pandemic coronavirus outbreak, and of course ensuring that patients are looked after appropriately and quickly in A&Es is an element of that, but this is about doing the right thing and applying the correct local judgments in a flexible and agile way.
Okay, well, 'cause I think that's the key word, isn't it? Flexible. You don't want to see NHS trusts make it, well, you don't want to see the unintended consequences of previous targets that in peacetime, if you like, made absolute sense, but in this time make no sense whatsoever.
Completely agree.
Okay, all right. I just want to move on to, again, building on some of the things that Luke said about the capability of primary care and community care. Are you confident that general practice have the capability and the resource to deal with the effect of this pandemic, but based on the modelling that already exists?
So I'm confident that general practice, like hospital practice, as Keith has outlined, will need to change the way that they are working over the next 4 to 6 months, because we have an unprecedented situation that will require that. Part of that, as again Luke asked and Simon replied, will be discontinuing a range of things in order to change that model, but some of it will absolutely be working in a different way. So I expect they will still be supporting their patients that they know, and after all, for instance, the vulnerable patients who are being asked to spend more time at home and to spend more time being shielded, these are the patients that actually GPs know the best, and I'm sure any GP would immediately, probably without going to their list, give a list of those patients that they were most concerned about. But they will have to support them in a different way. So that might involve more telephone conversations. It might involve more remote ways of contacting rather than people coming into the surgery. So I think this will absolutely force a different way of thinking, but I'm absolutely confident that practices are up to doing that, and actually many of them use models that I think are perfectly applicable to the situation that we are going to go into, and will be well used to the sorts of changes they need to make, although in an unprecedented time that those changes will have to go further than they might do normally.
Okay, so forgive me for just building upon this, just painting a scenario. So if you've got a patient with a particular long-term condition like diabetes or AF, and they're having problems managing their condition, and they're very used to already going into their GP on a regular basis and having that personal relationship. I know already in some GP settings, it's the case that you have to be on the phone at 7 o'clock in the morning to get an appointment and all the rest of it. How do you think that modelling would look like? Is it going to be very much more telephone
Yes, absolutely.
It must be. It must be. I mean, we need, particularly the patients you described who are vulnerable and they have underlying chronic conditions, they are the ones that we, as the government programme has been laid out, those are the ones that we do need to either increase their social distancing so that they don't get the exposure to the virus, and secondly, for those that are very vulnerable, and we will be saying more about that as they're defined in the coming days, then we will essentially be asking them to stay at home to protect themselves. So whereas at the beginning of this, and this is how fast it's changed, it was only 6 weeks ago that WHO said something to the tune of, it did not yet constitute a public emergency, there's no evidence of spread outside China. That was the 23rd of January. Yeah. Can you see where we've gone since then? We've had the repatriation flights, we've completely changed the model, we've been isolating people who had the virus in order to protect the rest of the society from acquiring that virus. We're now going to a position where we recognise there are vulnerable people who we need to protect, isolate them, to protect them, to make sure they don't get the virus. And so this is a substantial shift. And those sort of patients, that's where general practice will need to transform significantly. So CCGs have been given permission to ensure that the finances do not interfere with the way that the practices can adapt and change. So it is about video conferencing, it is about telephone consultations, it is about increased out-of-hours services so that if people need home visits, that can be arranged. So this is quite a transformational model. I suspect at the end of this, when we all sit down in a year's time, we'll have learned some really important things about traditional practice that will benefit the NHS and benefit our patients, and at the same time we'll have protected a lot more vulnerable patients.
And I think you said flexibility and agility, and that's absolutely the mindset that all of us will have to be in.
Because I'm thinking about people, if I may, like my mother and my father, who are used to that trip to the GP almost sometimes on a monthly, fortnightly basis just to manage their long-term conditions. Let's just get the message loud and clear. We're saying do not go to a primary care setting because this is a substantial change, as you've said. I mean, what are you actually doing to, other than the daily, which I think is very useful, the daily briefing that you see the Prime Minister having in every day about the change in the situation, what more is the NHS doing to provide that sort of essential and accurate information, not only to the public, but to NHS professionals too?
In terms of direct public communication, so on the NHS.uk website and the NHS Online website, there is the full information set, including the advice that came out last night from Public Health England on social isolation. And over the course of the next week, as you just heard, there will be specific contact made with the majority of people who are in the very high-risk group, who are particularly being asked to reduce their social contact and shield themselves from those other interactions so that they can have their questions answered about, I have an appointment scheduled for the hospital, or I need to be in touch with the GP. What are you recommending I do about that?
And what do you think we're doing? I mean, I've got experience of this already in my constituency and in my patch. I mean, what are we doing to counter misinformation that's already kind of out there in the public domain?
So we and the Department of Health and Social Care have been, and in fact the Department of and DCMS have been working with the social media companies, including Google, Facebook and others, to try and ensure that where ludicrous lies are promulgated online around treatments that most obviously won't work and are just a public scam, and I include, frankly, in this some of the homeopathic practitioners, but there are others as well, that is zapped by the platforms who are providing access to that damaging and scurrilous material.
And NHS.uk is the public point of truth. So if people need to go to find out what the position is, that's where they should go.
Okay, that's very reassuring. Just something very reassuring on a personal level. I mean, I've seen that there has been information provided to, or there's certainly been an announcement around pregnant people who are pregnant and how they should look after themselves. Is there going to be any specific information to young mothers of recently born babies? I say that as father of a very small baby.
When it comes to pregnancy, the evidence base in this virus is fairly limited at the moment because obviously it's a new virus and we have emerging information. But working with the Chief Medical Officer, we are urgently looking at that evidence base, and we will be issuing further guidance specifically around pregnancy and the period of pregnancy where we believe most care needs to be taken.
I'll just add to that, obviously we represent NHS England, but all of the activity is being done across the four nations at every level, between the NHSs and across the Chief Medical Officers, and the Chief Medical Officer of Scotland is an expert in the area of pregnancy.
And Chair, just one last question, if I may. And forgive me if you're not the right audience for this. It's just I had a phone call this morning with the Chief Executive of the Sue Ryder Hospices, and Just interested to know what sort of implications you've thought, what implications of the impact on coronavirus on, I suppose, the hospice sector could be for the NHS. For example, if they struggle to cope and they're beginning to say they can't take new patients for one reason or another, have you thought about how
So
that
I think
might
Hospices UK have raised this question with the Department of Health, and I know that the Department of Health are looking very carefully at whether or not additional support could be provided to hospices during this very difficult time.
Okay, that's very reassuring. Thank you.